Bartholomew has been found unconscious. The two girls must act accordingly to what they see is wrong. Kim begins to survey the scene to check for danger, possible cause of injury, and anything that may harm her. Kim yells out Bartholomew's name, giving him a verbal stimulus to excite responsiveness. He doesn't respond, so she gently shakes both of his shoulders to assure his unconsciousness. Luckily, Marissa is there at the time of the incident and is able to call 911. She asks the medics for an AED. Kim goes on to check Bartholomew's circulation, airway, and breathing. To check circulation, Kim takes her index and middle finger and places them on the lateral side of the neck to feel for a pulse in the carotid artery. She must make sure she checks the artery for 10 seconds, never crossing over the body and always palpating from the side. She then opens the airway by doing the head tilt chin lift using both of her hands. Now she checks Bartholomew's breathing with her ear to his mouth and eyes to his chest, looking to see if it rises and falls. Kim will begin rescue breaths once she sees that Bartholomew has a pulse but is not breathing. Doing the head tilt chin lift, Kim will seal Bartholomew's mouth with her own and give him one normal breath lasting about 1 second. While doing rescue breaths, Kim pinches the nose to assure that the breath does not escape and successfully travels into the lungs. She will do this once every 6 seconds, totaling to about 10 breaths in 1 minute. After the 10 rescue breaths are completed, Kim will recheck Bartholomew's CABs, circulation, airways, and breathing. She checks and finds that Bartholomew has lost his pulse and is still not breathing. When performing rescue breaths, you should always be sure to open the airway and seal openings by covering mouth to mouth and pinching the nose. You should offer one normal breath lasting 1 second and continue to do so every 6 seconds. This should be done for a minute unless the person loses their pulse, the scene becomes unsafe, the person begins breathing on their own, or the medics arrive. In this case, Bartholomew has lost his pulse and is still not breathing, calling for Marissa and Kim to begin CPR, also known as cardiopulmonary resuscitation. To perform CPR, Marissa will take her dominant hand and arm and fully extend the elbow and wrist. She will take the heel of her dominant hand and place it on the center of the person's chest in the middle of the nipple line. The heel of the hand should be directly over the sternum. She will take the non-dominant hand and place it on top of her dominant hand, weaving her fingers together. She will use her body weight to perform compressions while pivoting at the hip. The shoulders should be over the victim's body. She should push down on the chest at least 2 inches. She will pace her compressions at 100 beats per minute, completing 5 cycles of 30 compressions, followed by 2 rescue breaths. Be sure to count out loud to keep track of compressions with a steady rhythm. This will also alert others that you are doing CPR.
1 and 2 and 3 and 4 and 5 and 26, 27, 28, 29, 30. 1 and 2 and...
After completing 5 cycles of compressions and rescue breaths, Marissa will recheck Bartholomew's circulation, airways, and breathing. CPR should be stopped when the scene becomes unsafe, when you're too exhausted to continue, when the medics arrive, when the pulse returns, or when the victim dies. By now, the automated external defibrillator, or AED, should have arrived, and you should stop whatever you are doing and apply to the patient immediately. Before applying the AED, make sure the chest is fully exposed, removing clothing and body hair. In the AED kit, there will be designated pads for the body. Place each designated pad on the upper right portion of the chest and the lower left portion with respect to the victim in anatomical position. When the AED is turned on, it will give verbal instructions. The machine will first analyze the heart's rhythm. Be sure to check the area and make sure that no one is touching the victim when this happens. If a shock is needed, the AED will say so. Again, make sure the area is clear. After the AED has shocked, resume compressions as done in the CPR procedure. Continue the cycle of 30 compressions and 2 rescue breaths until unnecessary. Although we do not want to electrocute a victim, it is okay to place an AED on a victim with a pacemaker.
Are you going to the game today?
Yeah, I'm really excited.
Oh, awesome. It's going to be really... Oh, my God. Oh, my God. Keep coughing. Keep coughing. Are you choking? Are you choking? I'm CPR certified. Can I help you? Okay. I'm going to take my non-dominant hand and place it in front of her while I take the heel of my dominant hand and push into her back while bending her at an angle. I'm standing from the side so I can have easy access. I take the heel of my hand and place it between her scapula and hit hard 5 times. From the back blows, I'm going to reposition her for abdominal thrust. I'm going to take my dominant foot and leg and place it in between her legs while I take my non-dominant foot and leg and put it behind me, forming an L for my balance. I'm going to take my dominant hand and make a fist and take the thumb side of my hand and place it between her xiphoid process and belly button. With my non-dominant hand, I'm going to reach around and grab my hand while pushing in and up to force the food away from the lungs. I will do this 5 times.
You may stop conscious choking procedures when the person becomes unconscious or when the food or object comes out.
Bartholomew, how was your day? Bartholomew! Oh no! Oh no!
Unconscious choking.
Emergency. My friend was choking and he passed out. I need an AED.
Because Bartholomew is unconscious, Marissa is going to begin CPR by doing 30 compressions every 2 breaths. In between the compressions, she's going to check the airway for food in the mouth, and if food is seen, she's going to do a finger sweep. When doing a finger sweep, you take a finger and scoop from the back of the mouth towards you. After the food has been removed and the airway has been unblocked, Marissa will now perform 2 rescue breaths and resume compressions and finger sweeps as necessary. Thanks to all the help from Marissa and Kim, Bartholomew is alive.